with it. I think that, or I would like to think that as we progress in generation, that we're more open in talking about these topics and more aware. Listening to the conversation that Susan and Dr. Shonda had, things are confusing and they change over time. And it's important to know that, what maybe was recommended when I was a teen or in my early 20s is not recommended now. And so I like to use that as a starting point for any conversations, right? For parents who bring in their children for routine child visits, vaccinations, they probably are not going to know about the HPV vaccination because it wasn't something that was there when they were that age. Mm-hmm. And level setting this conversation, talking about HPV vaccination, that this is not the green light for sexual activity, although please do talk to your children about that. And I'm happy to do counseling as well. This is a cancer prevention vaccination. And I think that presenting it that way is true and accurate, but it can help to alleviate some of the taboo, stigma associated topics surrounding the vaccination. If anyone comes in between the ages of 9 and up to 45, this is a discussion to have. Absolutely, having it at a younger age, starting age 9, before sexual activity, helps to prevent the infection of HPV, because HPV, as I mentioned, is an STI. But you know what? All of us have probably had at least one strain of it if we've ever been sexually active. And so thinking about it in those terms, really focusing on cancer prevention, can really forward a conversation and have some folks who maybe are turning their ears off to this because they don't want to think about their kids being sexually active, really have them listen in a different way.